name is Jeff Moody. I'm a board-certified urologist here in Colorado Springs. I'm from Iowa originally, did a lot of my undergraduate and medical school training there, and it was at UCLA for my urology. Been here in Colorado Springs for about 17 years now. We feel very fortunate to live here. It's a beautiful community, and it's a very good medical community because there's lots of, essentially all the different types of specialties are available. One of the new things that we have at Pikes Peak Urology is a treatment for something called atrophic vaginitis. Now that's just a very long medical way of saying kind of pain and dryness that goes along with changes with women after menopause. And the standard kind of treatments for atrophic vaginitis have usually either been suffering in silence, which is something we don't really feel is an option for our patients because we like to help them and get them better. Topical, or meaning putting creams or things in the vaginal area, or even oral hormone replacement, which sometimes with time, with age, that becomes more risky or dangerous for women if they get in their 50s and 60s. And those are all possible treatments, but in general, they don't work that well. The creams are very messy. The creams have gotten very expensive, unfortunately, in the last 3 to 4 years, somewhere in the order of $200 to $300 a month. And some women develop some intolerance to the actual cream, so then it's something they can't even use. That's even leaving aside all the patients who have breast cancer, who in general, breast cancer patients cannot use estrogen anywhere in their body because that could run the risk of having the cancer come back. And so we've been thrilled that about a year and a half ago, we bought a laser. Well, we learned about a laser that we thought would be very helpful for our patients. And we ended up getting this laser. We've been using it for about a year and a half now, and we've probably had greater than a 95% success rate as far as improving pain, dryness, and there's some secondary benefits that we see with the laser that aren't really why we do the laser, but if women have slight loss of urine with coughing or sneezing or lifting, it helps with that. If they have some frequent urination, urgent urination, that's mild, that helps with that. If they have recurrent urinary tract infections, it appears to help with that. I think mostly because the physiology of the way this laser works, it's what's called a fractional carbon dioxide laser. And what that means is it takes a beam of energy of the carbon dioxide wavelength, and then it fractionates, or it splits it into kind of a very small grid. It's about 1 by 1 centimeter. And we can use that to treat the lining of the vagina in typically about 50 to 60 areas. That treatment, that energy stimulates the lining of the vagina to get back to the way it was 20, 30, 40 years ago. So it's increased elasticity or flexibility, increased blood flow, increased lubrication, and then along with all those other things, it gets the environment or the pH back to where there's no more bad bacteria. So that's why we think it's probably fairly useful from an infection prevention standpoint. Typically it's 3 5-minute or even 3 to 5 minute painless procedures that we do in the office. We space them about 6 weeks apart, and like I said, in general, we've had great results. A number of the patients, their kind of phrase for this is life-changing. And again, one of my favorite things is when my patients do well. So that's just a thrill for me that this is something we can offer them that is very beneficial for them and very easy for them as well.